Imagine trying to fix aging, degraded skin by injecting it with uh, the highly purified DNA of a male salmon.
Yeah, sounds completely wild.
Right, it sounds like some kind of bizarre biohacking fever dream. But this exact protocol is fundamentally replacing traditional cosmetic procedures in like some of the most advanced clinics in the world right now.
And I mean, the clinical data backing this shift is just staggering. We are looking at a complete paradigm shift in how we handle tissue degradation.
Yeah.
Instead of treating symptoms by just hiding them, this technology targets the cellular engines themselves, basically commanding them to rebuild.
So welcome to today's deep dive. We've got a really fascinating stack of clinical treatment guides on the table for you today. These are direct from aesthetic practices like Dr. Harry Clinic and Luna Clinic, alongside some really in-depth gynecological protocols from the Women's Health Clinic.
Right, because the applications are so broad.
Exactly. Our mission today is to dissect how this marine DNA, which the literature refers to as polynucleotides, how it's being used to regenerate everything from facial wrinkles all the way down to atrophied, intimate mucosal tissues.
Well, to understand why the medical community is moving in this direction, I think we have to think about how we've historically dealt with the physical signs of aging.
Which is mostly just masking it, right?
Spot on. It has essentially been a lot like dealing with a pothole in the road. You see a dip, you pour some filler in it, you smooth the tar over, and you walk away.
A purely structural approach.
Exactly. Just structural.
So it's a temporary patch job that doesn't fix the crumbling asphalt underneath the surface. You're just taking up space to make the surface look level.
Right, you're filling the void.
But this new wave of regenerative medicine, it's like dropping a molecular signal into that pothole that commands the road to weave entirely new asphalt from the ground up.
Yeah, using its own raw materials.
Hmm.
And to appreciate how that molecular signal actually works, we have to look at the environment it's repairing.
The extracellular matrix, right?
Yes, the ECM. This is the three-dimensional scaffolding that holds our tissues together. In our youth, this scaffolding is incredibly robust.
Because of the fibroblasts.
Right. Fibroblasts are the builder cells in the ECM, and they are constantly churning out fresh structural materials.
And the big three materials they produce are collagen for tensile strength, elastin for that snapback flexibility, and hyaluronic acid to hold water and keep the whole network hydrated.
Exactly. During our 20s, this system is a well-oiled machine. Cell turnover takes about 28 days. But as we age, that timeline stretches out.
It slows down dramatically, right?
It really does. It eventually takes up to 60 days for a single turnover cycle. The fibroblasts just become sluggish. They stop producing high-quality collagen and elastin, and so the scaffolding begins to collapse.
Which brings us back to the traditional treatments most people are familiar with. Like, if your aging skin is a deflating mattress, hyaluronic acid fillers are essentially just stuffing more cotton inside to force it to look plump again.
But you still have broken springs.
Exactly. You still have broken springs. But these new biostimulators are actually repairing the springs themselves.
Yeah, and the underlying technology driving this repair relies on what the clinical literature calls PNHPT, or highly purified polynucleotides.
Okay, let's address the elephant in the room here, because the sources are very explicit about where these polynucleotides come from.
The fish DNA.
Right. They are extracted from the gonads of male salmon trout. And on a purely intuitive level, taking reproductive DNA from a fish and injecting it into a human face, I mean, that sounds like it should trigger a massive, immediate immune rejection.
Oh, absolutely.
Yep.
The immune system is entirely designed to attack foreign genetic material, which is why the HPT, the highly purified technology part, is the critical factor here.
Because of how they process it.
Right. The extraction process is remarkably intense. The laboratories use extreme high-temperature sterilization combined with this really aggressive deproteinization.
So they are essentially burning away and chemically stripping all the proteins and peptides. Because proteins are usually what our white blood cells recognize as foreign invaders, right?
That is the biological key. By eliminating the immunogenic proteins, you completely remove the biological markers that would trigger an allergic reaction or an immune response.
Wow.
What survives this rigorous purification process is purely the DNA polymer backbone, just long chains of nucleotides.
And at that fundamental chemical level, the DNA structure of this specific marine species is highly compatible with human DNA.
Exactly. It's essentially just a raw signaling molecule.
So you aren't implanting fish cells. You're taking the raw chemical alphabet of DNA, stripping away all the identifying fish characteristics, and using those raw letters to send a targeted message to dormant human cells.
That is a great way to put it. And once those concentrated signaling molecules enter the tissue, they trigger a biological cascade that tackles the degradation from three distinct angles.
The first one being pure biostimulation.
Right, the most significant mechanism.
Because the sources mention that these high molecular weight polymers bind to a specific cell surface receptor called CD44. And I see this receptor brought up constantly in longevity research.
That's a major player.
It really seems to function like an ignition switch on a dormant factory. Like the fibroblast is the factory sitting there barely producing anything, and the polynucleotide acts as the key turning that ignition switch.
And the moment that switch is flipped, the fibroblast wakes up and shifts into overdrive. It begins rapidly proliferating and manufacturing entirely fresh, endogenous type I and type 3 collagen,
It's just an aggressive reprogramming of the cell's baseline behavior.
tricking your oldest, most depleted cells into behaving like they did decades ago.
That is wild.
It is. And while that factory is ramping up production, the second prong of the attack provides immediate environmental support. And it does this through profound hydration.
Now, I found this part a bit counterintuitive when I was reading through the sources. If we stripped away all the other molecules and are just injecting pure DNA chains, how is it hydrating the tissue without adding actual hyaluronic acid to the mix?
Right, it's a good question. The hydration actually comes directly from the physical structure of the polynucleotides themselves.
Oh, really?
Yeah. They naturally form a three-dimensional gel network that is highly hydrophilic, so they act like microscopic sponges.
Ah, I see.
They physically draw massive amounts of water into the extracellular matrix. This provides an immediate plumping effect while you wait for the long-term biostimulation to yield results.
So the DNA web itself is trapping the moisture. That is fascinating. And I guess that ties right into the third prong, which is cellular protection,
Exactly.
because the clinical data shows these polynucleotides acting as heavy-duty antioxidants. They actively scavenge free hydroxyl radicals.
And those unstable molecules, the free radicals, are one of the primary drivers of oxidative stress and accelerated aging.
Just bouncing around, damaging healthy cells.
Right. By neutralizing them, the polynucleotides are basically putting a protective shield around the freshly built tissue. So they build the new scaffolding, flood the area with hydration, and then guard the worksite.
Guard the worksite. I love that. And seeing all three mechanisms working in tandem really explains why this technology is suddenly everywhere in the aesthetic industry.
Oh, it's exploded.
The sources list multiple applications. You have pure polynucleotide formulas like Plynist for direct skin repair. There's Plynist Hair, which uses the exact same cellular ignition switch to stimulate dormant hair follicles on the scalp.
Yeah, the Scott protocols are showing incredible promise.
And you even see clinicians bridging polynucleotides with traditional collagen stimulators like Sculptra or Radiesse.
But the clinical guidelines for all of these applications share one vital caveat that any patient considering this really needs to internalize. The biological reversal is gradual.
It's a marathon, not a sprint.
Exactly.
If you go in for a traditional volume filler, you walk out of the clinic 30 minutes later looking different.
Right, instant gratification.
But because polynucleotides are relying on your own fibroblasts to build new tissue, it takes weeks or even months to see the final architectural changes.
But the trade-off for that patient is true tissue regeneration.
Yeah.
You are avoiding the fibrotic scar formation that can sometimes be triggered by more aggressive ablative aesthetic treatments.
Yeah, that makes sense.
You end up with structural integrity that is entirely your own native tissue. It's just functioning at a younger capacity.
And that concept of true tissue regeneration logically leads us to a really fascinating application of this science because we've established that the loss of collagen, elastin, and hydration causes visible degradation in the face and scalp.
Right.
But that cellular starvation isn't localized, is it? When systemic hormones shift, particularly during menopause, that exact same degradation happens to internal mucosal tissues.
It absolutely does. The sharp decline in systemic estrogen during perimenopause and menopause removes a critical support mechanism for fibroblasts across the entire body.
The whole system feels it. Exactly. But the impact is uniquely devastating on the pelvic floor and the vaginal epithelium.
Yeah. The gynecological protocols we're looking at from the Women's Health Clinic refer to this as vulvovaginal atrophy, or VVA, which falls under the broader umbrella of genitourinary syndrome of menopause.
And it is incredibly common.
It is. And for you listening, if you are navigating this, you know how profound the symptoms are. We are talking about severe tissue atrophy, extreme dryness, a complete loss of elasticity, and dyspareunia, which is chronically painful intercourse.
And historically, the standard of care for these symptoms has been fairly limited, primarily topical estrogen therapies, which, not all patients can or want to use,
Right.
or they're simply relying on temporary lubricants that don't address the underlying structural collapse of mucosa at all.
Just a Band-Aid. But clinicians are now taking the exact same salmon DNA technology used to rebuild facial scaffolding and deploying it to regenerate the vaginal mucosal barrier.
It's a brilliant pivot.
The clinical protocols detail a specific Class 3 medical device formulated for this called Nugen. And the formulation strategy behind Nugen is so smart because it addresses both the immediate physical suffering of the patient and the long-term need for underlying tissue repair.
Well, let's look closely at that formula because it's a very specific cocktail compared to the pure facial treatments. It's basically a 50-50 split, right?
Correct.
You have 10 milligrams per milliliter of the PNHPT, the purified fish DNA, mixed with 10 milligrams per milliliter of raw, non-cross-linked hyaluronic acid.
Yes, to provide that immediate moisture.
Plus, they throw a third ingredient into the mix, which is mannitol. Now, I usually associate mannitol with artificial sweeteners or like diuretic medications. I'm guessing in a mucosal injectable, it's acting as a stabilizer for the hyaluronic acid.
You're spot on. In this context, mannitol is serving as a specialized biochemical bodyguard.
A bodyguard, okay.
Yeah. While hyaluronic acid is fantastic for flooding dry, atrophic mucosal tissue with immediate moisture, the human body naturally produces enzymes called hyaluronidase.
And they break it down.
Right. These enzymes quickly identify injected hyaluronic acid and begin dismantling it almost immediately.
So the mannitol intercepts those enzymes. It prevents the rapid enzymatic and oxidative degradation of the hyaluronic acid, ensuring the immediate hydrating effects last significantly longer in those delicate tissues.
Exactly. And that buys the polynucleotides the runway they need to wake up the fibroblasts and rebuild the native collagen network.
The clinical outcomes documented in the literature demonstrate a remarkable synergy with this. This combination restores the physiological turgor, the firmness and elasticity of both the superficial skin and the deeper mucosal layers.
But perhaps the most critical benefit here is the impact on tight junction proteins.
Yes. The sources specifically highlight a protein called claudin-1. Now, for those of us who aren't cellular biologists, tight junctions are basically the physical seals between your cells.
Like mortar between bricks.
Exactly. If those seals break down, the tissue barrier becomes permeable, leading to chronic inflammation and extreme sensitivity.
And by stimulating the repair of claudin-1, the Nugen protocol actively restores the natural physical barrier function of the vaginal epithelium.
Which is huge.
It is. It downregulates the chronic inflammation that makes vulvovaginal atrophy so intensely painful on a daily basis.
It is genuinely rebuilding the environment from the inside out. But delivering this cocktail into such a sensitive area requires absolute precision. Administering this is obviously nothing like applying a topical cream.
No, not at all.
The sources get incredibly granular about the physical injection technique.
They have to, because the goal is to target the exact layer where the most active fibroblasts live, so the injections have to be extraordinarily shallow. The clinician targets the dermal and submucosal lamina propria planes.
Let's clarify that terminology so we aren't leaving anyone behind. The lamina propria is essentially that highly vascularized connective tissue lining just beneath the surface of the mucous membrane, right?
Yes. It is packed with tiny blood vessels and nerve endings.
Very sensitive.
Extremely. So to hit that precise layer, the clinician inserts the needle at a very shallow 30 to 45 degree angle, penetrating to a depth of only about 3 millimeters.
3 millimeters. I mean, the margin for error there is basically zero.
Yeah, the technique demands a highly trained hand. Clinicians use methods called microwheels, which are tiny, localized droplets, sometimes referred to as micropomfy in the literature.
Okay, micropomfy.
Yeah, as well as linear retrograde injections, which is laying down a continuous microscopic line of the gel as the needle is slowly withdrawn.
And how many sessions does this take?
A standard restorative protocol requires 3 to 4 of these sessions, spaced about 7 to 15 days apart, to achieve the optimal accumulation of the signaling molecules.
Okay, so now diving into the post-injection care. There is a really fascinating juxtaposition in the clinical guidelines regarding manual massage.
Oh, this part is crucial.
Right. The protocol explicitly mandates that the clinician perform a prolonged, deliberate manual massage across the treated area, particularly the anterior vaginal wall, immediately following the injections.
And that clinician-directed massage is a non-negotiable part of the procedure.
Why is it so strict?
Because when you are depositing dozens of microdroplets of a highly viscous gel into a very tight mucosal space, you run the risk of the particles pooling or clumping together.
Ah, okay.
The doctor uses a highly specific pressure protocol to manually disperse those microwheels. That specific post-injection manual massage protocol ensures uniform dispersion of the polynucleotide microdroplets across the anterior wall. It has to cover the entire lamina propria plane evenly.
But the sources pivot immediately from that instruction to a very strict warning for the patient. Like while the doctor must massage the area vigorously in the clinic, patients are explicitly ordered to never attempt any manual massage or manipulation of the anterior wall themselves at home.
Right. The anatomical realities of the pelvic floor make patient manipulation extremely hazardous. As we discussed, the lamina propria is sitting right on top of dense vascular plexus networks.
Those complex webs of fragile blood vessels.
Exactly. And in a patient suffering from menopausal atrophy, these tissues are already paper-thin and highly susceptible to trauma.
So, if a patient goes home, feels a slight bump where a microwheel hasn't fully integrated yet, and decides to, I don't know, aggressively massage it to smooth it out, what actually happens?
They risk causing significant collateral damage. The clinician knows the exact vector and pressure required to move the gel without crushing the vascular networks beneath it.
But a patient wouldn't.
Right. A patient lacking that tactile training could easily rupture those delicate microvessels. That triggers severe localized edema, massive swelling, or worsening bleeding in an area that is notoriously difficult to compress or bandage.
It's the ultimate do not try this at home scenario. The uniform dispersion has already been scientifically handled by the doctor before you even leave the clinic.
Exactly. Leave it to the pros.
Any subsequent tissue handling must be strictly directed by a medical professional. I mean, even though this is minimally invasive compared to surgery, it is still a highly precise medical intervention that demands absolute respect for the tissue's fragile healing window.
And the discipline required in the recovery period reflects just how powerful this biological intervention really is. You are fundamentally altering the structural behavior of the tissue.
Which is incredible. Let's just zoom out for a second and absorb the sheer scale of the scientific leap we've covered in this deep dive.
Huge.
It really is. We started with the wild reality of harvesting reproductive DNA from male salmon trout. We uncovered how rigorous high-temperature sterilization and deproteinization strip away all the allergens, leaving behind this pure, biocompatible molecular messenger.
A messenger that acts as an ignition switch for CD44 receptors, waking up dormant fibroblasts to weave fresh collagen and elastin.
All while simultaneously wrapping the tissue in a hydrating antioxidant shield.
Yep.
And we saw how this exact mechanism is revolutionizing multiple fields of medicine simultaneously. It's moving us away from structural masking, just stuffing cotton into a deflating mattress, and leading us into an era of true biological regeneration.
Whether that is reversing facial aging or healing the intensely painful mucosal collapse of vulvovaginal atrophy.
It represents a profound shift in medical philosophy. We are finally leveraging the body's innate, ancient ability to heal itself, provided we can hand it the correct chemical blueprint.
That's exactly it, handing it the blueprint.
Which leaves you with a lingering question to ponder long after this deep dive wraps up. If biotechnology has advanced to the point where we can use marine DNA to trick our oldest, most depleted cells into behaving exactly like they did in our 20s, to completely rebuild mucosal barriers without invasive surgery or systemic hormones, what other failing, degraded systems in the human body are just sitting there waiting for the exact right molecular signal to heal themselves?